All right, everyone. Well, we are right at 3 o'clock. I've seen a number of people come into the room. And so I'll get started with introductions and hopefully a few more people trickle in as we get started. My name is Rebecca Reese. I use she, her pronouns, and I will be moderating this session today. I am joined by Jessica Stoker, and she uses she, her pronouns as well. And she will be managing the tech side of the Zoom and making sure everything's running smoothly. So if you have any issues, if they come up, if you can chat Jessica, she can help you out as best as she can. You're all muted right now. And so if you have a question as it comes up, please feel free to enter it into the chat, and we will have a Q&A session at the end of each presentation. So if you don't have a chance to ask it in the chat, there will be an opportunity for you to come off mute during that Q&A session. Like I said, though, please feel free to use the chat box to add in comments, any questions. A little housekeeping for if you feel comfortable, please change your name to include your pronouns. And you can do that in Zoom by clicking on the 3 little dots. If you hover over your screen, there are 3 little dots that pop up. And if you click that, you can scroll down and find the rename function. So to get us started, this session, we're all here today in this virtual Zoom room, thanks to our generous sponsorship from Champ Software. And we have David Smith here to say a few words and share a little bit of info. So David, if you want to come off mute and say a few words, that would be great.
Hi, everybody. My name is David Smith. I am a senior account executive with Champ Software. I've been working with public health nurses now for 18 years in the capacity that our company sponsors local health departments. Our company was founded by a former community health director, and our name CHAMP actually is an acronym for Community Health Agency Management Program. What's unique about CHAMP, I think, is that we offer a lot more than an EHR, and your conference today is really talking about the culture of data. And that's one of the things that I think really makes us stand out, is we have believed that at the local health department, you need to have all of your data, and you need to have it accessible easily so you can measure your process, see what your impact is, and then manage that moving forward. So when you look at our program, if you do, we really believe in a comprehensive agency management philosophy. And so we have modules like client data management, case management, point of care, EHR, of course. Data management is a big area for us. Fiscal management of grants, budgets, all those kinds of things. Calendar management, time tracking, and tools for customization and configurable reports. And we serve about 130 local health departments across 10 states in the Midwest and a couple on the West Coast as well. And in all of our 160 counties, they're managing about 80 different various public health programs and collecting the data for that and converting that into strategic, actionable data. Our tagline is, we believe in public health, and that's really true. Our goal is to help public health officials accomplish their mission to deliver high quality care to their communities. And one of the ways that we do that is the data management that you're talking about throughout this conference. We don't just allow you to collect data, but we also really believe in let's stop building data cemeteries or data EHR data cemeteries. We really believe that all of your data needs to flow back to you in 100 different ways so that you can write your own success story, prove to people the impact you're having on public health, and again, measure your process and make it better in the future. So standard terminology is really another bulwark of what we do. We use an American Nurse Associated recognized terminology. And a quote from one of the writers of the book that we use in our terminology is, having quantitative data demands that huge amounts of data are collected and processed. However, that data remains largely in EHR data cemeteries. That's why we really have got to get away from that and move to not only collecting data, but using that data to convert it into knowledge, information, and wisdom. And so really that is what we're all about. We've been doing this for about 36 years. So we've been specifically and exclusively geared to helping local public health departments. We'd love to help you there in Colorado as well.
Great. Thank you again so much for joining us and for sharing a little bit about CHAMP software. We very much appreciate the support to make sure that these sessions and these presentations get shared to such a great audience. So thank you again.
Okay.
So today we have 2 presentations in this session, and each will be about 20 minutes long with a 10-minute Q&A following each of them. We'll also have a 5-minute break between the 2 presentations, just to get up, stretch, take a second, and then we'll reconvene. So if you have any questions, please feel free to reach out to myself or Jessica. Again, Jessica will be helping on the tech end of things. So the theme of this session that we have today is equitable community data collection and visualization. Connecting it to the overall theme of the conference, I think we all understand the importance of equitable data systems, data structures, data visualizations. I think it should have been the name of the game for a lot longer than it has been, but I feel very grateful that it's gotten a lot of attention and that we have a whole session dedicated to it today, or multiple sessions. So our first presentation today is titled Assessing Inaccessibility, Involving Community Voices in the Substance Use Dashboard. And we are joined today by Olivia, Leyva, and Anne Hill, who will be presenting for our first talk. So I will hand it off to you both and we can get started.
Awesome, thank you so much. I will share my screen now and we can jump into it. Okay, can I just see a thumbs up to know that it's looking good? All right. So before we jump into this, I really want you all to take a moment and just look at this graph. It's meant to be confusing on purpose, but truly this kind of ties into our presentation today. Graphs for individuals who aren't seeped in data and don't interact with data every day can be confusing and intimidating. It can be overwhelming to look at graphs and see the data. If we want data to be a source of power for communities, it's important that we look at the accessibility of data visualizations. So that brings us to, as Rebecca mentioned, the title of our presentation today, Assessing Inaccessibility, Involving Community Voices in a Substance Use Data Dashboard. And I'll introduce myself. My name is Olivia Leyva, and I am from the Pueblo Department of Public Health and Environment, she, her pronouns, and I am a health promotion specialist. And I'll let my colleague Anne jump in and introduce herself really quickly as well.
Thanks, Olivia. And my name is Anne Hill, she, her pronouns, and I'm also working with the health department in Pueblo.
Awesome. So jumping into kind of our learning objectives for this presentation today, really what we want you all to take away is seeing this connection between improving the accessibility of our publicly available data dashboard, but also how we brought and plan to bring in the involvement of community voices and how this ties overall to health and data equity. We also hope that you'll be able to identify 2 action steps that you can take back to your communities or coalitions to really think through how you can involve community voices in the review and also revisions of data visualizations that you might have. And then the final learning objective is really hoping that you'll be able to potentially replicate or even adapt some of the action steps that we have in order to really think through having a health equity perspective when improving public-facing data visualizations. So as an introduction to this work, this dashboard really came about through a grant provided by the Bureau of Justice Assistance, and this grant was received in 2019. And the true purpose of this grant was to utilize near real-time data to drive decisions in regards to current and emerging drug threats in the community. Our dashboard is publicly available and it's housed on our health department website. So you can navigate to that going to our regular webpage, pueblohealth.org, in the A to Z directory and substance use data tab. And as I mentioned, it truly is this near real-time data where we are receiving data monthly from our partners. And I do want to give a shout out to our data partners because obviously this dashboard wouldn't be possible without them. We are so fortunate, and that is definitely a strength that came from this grant, to have wonderful partnerships and collaborations with partners in our community. So we receive this monthly data from a wide variety of partners, including public safety entities, being our sheriff's office and also police department, different healthcare organizations in the community, whether that be local hospitals or even some more specific treatment providers. We receive data from our coroner and also harm reduction agencies too. So like I said, this dashboard, its true inception couldn't be possible without the help and collaboration of our data partners. And just to dive into a little bit more of how the dashboard truly came to be about in the first place, it started with having our substance use response ecosystem, our Schroer group, which is a local community of stakeholders that operate in a wide variety of targeting substance use. We have providers, we have peers, so it's very representative of stakeholders. And this group actually helped to apply for the initial grant. And then through that, the grant required the creation of having a stakeholder committee, but then also having an executive committee, which is made up of some more of the C-suite level individuals, being like the chief of police, our fire department chief, also having CEOs, COOs of hospitals, even the director of our own health department sits on this executive committee. And then also those individuals that sit on the committee were to identify a data provider or an individual that would sit as a part of the data pod to help us provide and gather that monthly data. So after getting these groups together, then it was time to lay out the research questions and then also get those data use agreements into place. And I know that a lot of times that really has been the holdup, is getting those data use agreements through the process. So definitely after that, once we were able to get those in process, we gathered our monthly data collections. It was placed into our data warehouse. And then from that, the data dashboard was created, looking at some of the measurements we were gaining and seeing which ones to be publicly available. And then in turn, truly coming back to that original intention of this grant, to utilize that data to look at the current and emerging drug threats in our community and to find community solutions.
So after the official launch of our data dashboard, which occurred approximately in May of 2021, there was a series of events and activities that provided this window of opportunity for our health department to really think more authentically about health equity and data equity through the inclusion of community voices and those with lived experience. And we are using very broad definitions when we think about community voices, and that truly is residents of Pueblo County from all different populations that live within our county. And then when we think about lived experiences, we're really tailoring it to those who have had a past experience or are currently living with a substance use disorder and or on that recovery journey. Next slide, sorry. So these series of events and activities have occurred over the past year, and they are varied. There was certainly a recognition, number one, that while this dashboard had been inclusive of a variety of sectors and partnerships, that it did not involve those who were affected, nor did it necessarily include the ideas and thoughts and perspectives of our community residents, our members. And we also then were receiving a lot of feedback from our own data pod members who are saying, perhaps we need to revise and rethink and consider ways that we could make this dashboard more accessible, perhaps even more understandable. We also then started taking track and note of the overall participation on the dashboard, as well as the average duration. And anything basically past June of 2021, we started to see a decline in overall interest. We were very lucky to have two opportunities in which we got to present to city and county leadership. And in one of these particular presentations, it came to us, leadership was talking about, it's really hard to get to your dashboard. It took 3 to 5 clicks to be able to find it. that is a barrier, right? When we think about community members trying to find this type of data. Additionally, they also were concerned about some of the visuals seem convoluted and not necessarily very easy to understand, which, as Olivia talked about beforehand, doesn't empower people, right? It's harder to understand what you're looking at. Like many other communities, there is this sort of pending, hopeful opioid settlement funding, which will shore up and really improve our overall stakeholder investment and substance use and prevention activities. But we were also lucky enough to receive some health equity funding. Not only did this keep our interest in really working towards improving overall health and data equity, but it also provided that funding where we could actually think and plan and do it intentionally. Lastly, there is this impact of COVID-19, which has negatively affected Pueblo as well as many other communities along the Front Range. Next slide. So when we think about COVID-19, Pueblo overall has a high social vulnerability index, which means when there are big disasters such as COVID-19, it does unjustly impact places like Pueblo County. And in this case, we're thinking about deaths. Not only did we have a large number of COVID deaths, but there was also this indirect impact to additional deaths above and beyond what we had normally seen in past years. We also saw an increase in fatal drug poisoning. So while not statistically significant, there was an increase with fatal drug poisonings from 2019 to 2021. Based on data that we received from our harm reduction partners, we actually knew that there was a massive increase in not only distribution of naloxone and Narcan kits, but also in self-reported use of naloxone and Narcan events. Fentanyl has also impacted our community in many, many ways. It's increased, obviously, when individuals test their drugs, and we've seen an increase over time in testing with test strips for heroin and methamphetamine. Additionally, we've seen an increase in the number of fentanyl-related fatal drug poisonings. Next. So all of these events and activities and COVID-19 have allowed us to then really think about how we could intentionally and authentically involve community voices. And these are sort of like the outline of events that we have been working towards. So first off, it is this review of our current dashboard with our data pod members and really thinking about things that we as a data pod could do that would allow us to improve accessibility and also the understanding of the data. We then had more in-depth discussions with our data pod about how we could create a plan to involve community voices and those with lived experience in not only reviewing our dashboard, but also then truly thinking about how we can involve these individuals to sit and have a seat in our data pod meetings. One part that we really wanted to sort of pilot first off was getting an idea of what it would be like, what questions we should ask those with lived experience. And so we ended up piloting a dashboard review session with our own employees, individuals that had less data experience. And that sort of gave us a taste of how we could, in fact, improve some parts of our data dashboard. As I mentioned beforehand, we were lucky enough to receive a grant from NACCHO that was related to health equity and overdose prevention. We are now paired with a mentor from New York City, and they have opened our eyes to additional and other things that we can do related to data and health equity. We are currently in sort of this, like, you can see the arrow. We're right in between this area and also where we're going to actually begin discussions with peer specialists to review our data dashboard. We will then follow that with collecting narratives from those with lived experiences and creating and adding to our dashboard with a much broader understanding of substance use and substance use prevention and activities in Pueblo County. And this all is to lead towards this overhaul of our data dashboard. And what's also not included here is that we do want to then truly include community members as well as those peer specialists or those with lived experience as members of our data pod. Next slide. So just to delve a little bit further into specific action steps that we have done to improve data and health equity. As I mentioned beforehand, we started working with our data pod to improve our overall dashboard. And these are revisions. They haven't necessarily gone live yet, but we've thought really, really intentionally about how we could make our dashboard more accessible? Well, instead of 5 clicks, could we not, of course, change where our data lives on our website? And we ended up doing that. So now there is, in fact, a link that goes directly to data. We really were thoughtful about colors, a table of contents, a glossary and definitions of words that may in fact be foreign or different for other people. We've thought about adding in a resource page as well as a video to help people explain how to use the dashboard and make it more interactive. Next. Additionally, I talked about we had these sort of very in-depth discussions with our data pod about involving those with lived experiences and community voices, and they were already on board, but we wanted to make sure that we were very intentional with what we decided to do. And so we asked specific questions. Why would we want to involve, right? What was the reason behind involving individuals with lived experience and community voices in collection and visualization of data? What was the goal or objective? How can we be inclusive? And one of the problems, as you'll note, is that we didn't start from the get-go involving these individuals. We're in mid-course, and so we want those voices to feel included. We want them to feel valued. They are true experts. We don't want to feel like it's a Band-Aid. And then lastly, what would the role be of these individuals when we're able to truly involve them into our data pod? Next slide. Additionally, another action step, as I talked about, was this piloting of a dashboard feedback session with our health department employees. And what we were truly trying to get at is and these were the questions that we used, like, what do they see when they look at these visuals? And what does it mean to them? It's one thing what it means to us, but what does it truly mean to them? Do the data that's presented and the visuals available, do they make sense? Are they important? Are they not important? What are the main takeaways? Like, how could they stretch or put this story together? And then overall and overarching, which graphs and visuals do they like best?
All right, let me hop off of mute. I'm notorious for speaking without being off of mute, so had to double check that. But now I'll jump into kind of where we are in the process. As Anne talked about, we're still working towards our overall eventual goal of overhauling and then keeping continuous engagement. So just running through some of those current efforts as they are at right now. All right. So first, running through kind of the results that we got from that pilot dashboard review. So we conducted this review with 7 participants, and 6 of which were conducted in a true kind of focus group format, and the other was an individual who wasn't able to attend that session, done at a separate time with Anne and myself. And truly, these individuals were recruited from the existing employees at the health department, but really intentional being about individuals who maybe didn't have as much knowledge about substance use topics, and also individuals who weren't steeped in data. We did, originally it was 1-hour sessions, but these individuals were actually so engaged in providing their feedback that they allowed us to continue for 30 more minutes in order to review all 7 of the current dashboard stories or views that we had. And truly from this pilot group, the overall recommendations that came out were having an introduction, as Anne had kind of touched upon before, that really lays out the purpose of the dashboard and also provides potentially a video or something showing how to really navigate the dashboard. They also recommended having more cohesion with our data visualizations and views. There was it seemed a little to not flow as well for them. Also, they mentioned, being more familiar with vertical graphs and liking those views. And then on the other side, they said that data over time was not personally grabbing, which was definitely something that I think Anne and I would have never thought. So once again, a highlight of getting this feedback. They also pointed out inconsistency with some of the age groups from visualization to visualization. And then finally that glossary. But I think one of the most important pieces was that after we gathered all of this information from those discussions, we reported these findings back to the individuals to make sure that what they had said was valid, and to make sure if they had anything additional that came up, they had the space to provide their feedback. For us, it's been very important to be mindful about making sure that they feel like we're listening to them. Along with what Anne had mentioned, We are fortunate enough to have received a health equity and overdose prevention mentorship, where we've been paired with the New York City Department of Health and Mental Hygiene, in specific individuals from their Bureau of Alcohol and Drug Use Prevention, Care, and Treatment. And going into this work, Anna and myself had some different focus areas that we brought to the table for our work plan. But of course, after having discussions with our mentor, they were able to truly help us see some things that we may have been overlooking or not even thinking of at all. So this included things like a community advisory board, thinking through how we could potentially in the future set that up, mapping substance use data resources, working in small numbers, just definitely a lot of great feedback from our mentors in terms of how we improve health equity and data equity moving forward for our organization. Also jumping into what's coming next is a dashboard review with our peer specialists. So this truly is, we are fortunate enough to have a peer pod, what's termed, but it really is a monthly meeting time for peers in Pueblo County to come together and discuss different issues that they're seeing and kind of give each other feedback and input. We've been fortunate enough we ran it by them hosting a dashboard review with them. And this group is made up of 27 members, representative of 6 different agencies in Pueblo. And we actually will be conducting this review using some of those pilot questions and of course reviewing it with our mentor. And we'll be conducting that later this month. So something exciting and kind of the culmination of the pilot groups. Finally, another portion of what we've been working on is gathering narratives. We've seen that combining stories with dashboard technology is powerful. It's powerful for people to see themselves or stories represented in the data. It makes it hit closer to home. So we've also been working with our mentors to determine next steps. And 2 options we've been weighing are utilizing current stories that we have from a campaign that was run through the health department termed Your Words Have Power, that focused on destigmatization efforts, utilizing those existing stories, or potentially going out and conducting different primary data collection to gather other stories that might be more fitting for the dashboard. Overall, just touching back on some lessons learned that we think are important for you all to know should you be interested in conducting something similar looking at accessibility. So definitely big lesson learned, don't underestimate the amount of time it takes. I think Anne and I, looking back, we're definitely optimistic of being able to receive this grant and immediately jump into, and we didn't really think through kind of all of the work plan and planning and all of those things that came at the beginning. So that's definitely pushed our timeline back. Also thinking about overhaul versus small pieces, because we decided to do one massive update, it definitely has been time consuming and more tedious than maybe small pieces have been. Also having a direct purpose and audience for visualizations. As we've looked through and gotten just this initial feedback, it really has brought to light that maybe we weren't too intentional with what we wanted, how we wanted to visualize things. And also maybe different audiences interact with these visualizations in a different way. Also keeping data visuals simple. As Anne mentioned, beginning with data equity at the forefront, I think this process probably would have been simplified if this was the intention going into the actual creation of this dashboard in the beginning. Being intentional with data collection, making sure that we have a purpose for the data we're gathering, and then obviously ensuring community and partner voices are included. I think that should be at the basis of any work that is done, especially to help the community out, is making sure that you have the voices of those impacted involved in your work. And with that, that concludes our presentation. There is our contact information. And of course, if you have questions, we can jump into the Q&A after this. So thank you.
Wonderful. Thank you both so much. That was awesome. I was like frantically taking notes. I think a few things that really stood out to me were, I just really appreciated what your phrasing around like the Band-Aid solution and not wanting to be a Band-Aid solution, because oftentimes I think we find that maybe it wasn't upfront, and that doesn't mean we should scrap community engagement and inclusion and equity altogether, but trying to, do it authentically as best as you can later in the process. And so I just really appreciated that transparency that you offered. I know there was one question just about slides, and those are available on Schedule on the conference website, so you should be able to view those. But I will give everyone a moment to offer up questions. I just saw one come through the chat, actually. There's a few, so I'll start with one. Can you provide an example or describe how you plan to include personal stories onto the dashboard?
I think that's a great, we're actually working with our mentor. In fact, we have a meeting next week, and they gave us actually a training or TA session this week, Olivia, thinking about mixed methods. So the idea of really having that quantitative, the graphs and all that, and then including some form of stories. I can't say exactly how this is going to look, but I think that they provided us some information, and then Olivia and I are going to take that and move forward. So more to come. We can report back.
Excellent. I know you've talked a lot about your mentor and this mentor experience. And so Carolyn asked, how long is your mentorship with New York DOH? And what are some things that you may want to do in the future to utilize the mentorship? Sounds like you're already doing a ton.
Yeah, so our mentorship, it began in January and it will end in June 30th. So it's a pretty short mentorship, but we've definitely just been, it's been great to have, somebody objective who doesn't really know Pueblo and doesn't have the perspectives on Pueblo kind of weigh in and see. And obviously we look to New York as kind of this guiding health department. So it's been great, but definitely some of the other things that we've talked about is looking at how we can potentially map some of the substance use data, also mapping resources as well. They've talked about, as Anne mentioned, we've done TA on incorporation of narratives and that qualitative data. But definitely they've talked about even community advisory boards, which was something we didn't go into this mentorship thinking about, but really how do we involve our community in meaningful ways and get their feedback on more than just what we're doing with this substance use data, but with all things that are coming from the health department. So that's kind of been really just wonderful. And we've been, any source of knowledge that we can get from them, we've definitely been grabbing a hold of.
And I'm sure you are, whether indirectly providing them with a lot of knowledge. Like New York is very different from Pueblo. And so, they each have very unique assets to provide and strengths. And so I'm hopefully they're learning just as much from you as well. We have one more question. So. Oh yeah. We have one more question in the chat as well. Did you all hold any community engagement events? And if so, what types of events worked and what didn't?
Not thus far, but that certainly could be in the cards as we move along. As Olivia suggested, if we are able to create a community advisory board, we certainly could then also offer some form of like community forums. Unfortunately, as many of you know, and I didn't say this, but COVID has made any in-person meetings very difficult. The grant really got off the ground truly in like November of 2019. So there were a few months in which we were able to gather stakeholders and work with them to think about software and think about measures that we would want to collect. And then boom, March 2020 hit. So it's not to say that that's an excuse, but it certainly has impinged a lot of the other work that maybe we would like to do. So I appreciate that. And I think we're going to write it down and maybe we'll be able to do it. So.
And truly some of the ideas that we've kind of spitballed coming off of this is really taking this to different, maybe like the public library. We've been thinking about partnering with them to reach the community in that way, not only in terms of showcasing this data dashboard, but also hosting events on data equity, showing individuals how to interact and utilize data as a tool.
Great. I actually think that partially answered the next question, or at least started to, but we have one more about identifying community members to provide feedback. So it sounds like that's probably still in like an early phase. The initial feedback you got was from internal partners. Is that correct? But then the library, I don't know if you want to, sounds like the last question might have covered most of that, but if you have anything else to add about identifying community members, feel free to add that in.
Yeah, and that's truly where we will rely on New York City, because they have so many different community advisory boards that are, you know, giving their expertise on different topics, that we will really engage them to identify the community members that need their voices heard from Pueblo. So definitely.
And I saw that David just put in a link to livestories.com or livestories.com. And he just asked if anyone's familiar with it. David, I don't know if you want to say anything about that site at all.
Well, it's a vendor who helps tell those stories and do data with civic public health organizations. They're a member of NACHO, and you can just go to their website and look that. I think there is a county in Colorado that's one of their case studies, actually. I think it's Johnson County maybe, or something like that. So just thought I'd mention it. Jefferson County, sorry, I knew it was a president.
Yeah, great. Thank you for sharing that. We have just a minute left. So this is actually a good wrap-up question for you all, but how can we hear more about when this process is complete? Should they check back at on the dashboard, or are there plans to present some more of these results or the process?
So both, all, we're happy. Olivia and I can share again, not only our contact information in the chat, so that if you guys are interested in learning more, we're happy to also talk with other, communities, because I feel like just what, we're learning from New York City, but we can probably also learn from other communities too. So Olivia, were there other? We're hoping maybe the dashboard will go live in June or July, but don't quote me on that. So.
Yeah, definitely still tentative. We're trying to be mindful of our time now, because we're definitely optimistic, but we really truly hope to, once we get this all together and do an overhaul, to really publicize and put that out. So definitely you can check back, but as Anne mentioned, we're also more than willing to be contacted and keep you updated on how things are going.
Great. Well, thank you both again so much. And thank you everyone for your thoughtful questions. Just an extra kudos as well. I know transparency and accessibility of the dashboard, and I just Googled substance use Pueblo before the session, and it popped right up on my first click. So it's definitely a little bit easier than maybe you think, although it sounds like a lot of effort has gone into that. But thank you both. And if you want to pop your information in, people can get in touch. We'll take this time to have a 5-minute break. So we'll come back at 1:43. I'm subtracting 2 hours from the East Coast. So 1:43, and we'll kickstart our next presentation. Thank you all. Okay, it is 1:43. I hope people had a quick chance to stretch before jumping back in. Just a reminder for those of you who may have taken an extra relaxed break and forgotten. If you have any tech questions, please feel free to reach out to Jessica Stoker. She can help you with that, and she's providing tech support for this meeting. My name is Rebecca Reese. I use she, her pronouns, and I am moderating this wonderful session. And I'm really excited to kickstart our next presentation, which is entitled Storytelling as Data, Getting to the Root with the Latinx and LGBTQ plus communities. And we are joined today by Janice Stiglich and Audrey Schroer, and they will be sharing their work with us today. So I will hand it over to you both to get started. Thank you.
Thank you, Rebecca, and thank you all for joining us today for our presentation on Storytelling as Data, Getting to the Root with the Latinx and LGBTQ communities. I am Audrey Schroer, I use she, her pronouns, and I am the project manager for A La Raíz.
And I am Janice Stiglich, use they, she pronouns, ella, ella, and I'm the principal investigator for the project.
So To the Root, A La Raíz is a project of Boulder County Public Health. And as public health practitioners, we are doing this work of storytelling as data collection because we have a vision that as a result of To the Root, A La Raíz in 2026, the Latinx and LGBTQ plus communities in Boulder County are going to be well-resourced with the information, finances, structures, connections, and sources of legitimate power to implement and sustain prevention and harm reduction practices. And the overarching process for our project is to continuously use data to see trends in the Latinx and LGBTQ plus communities and to provide education opportunities to increase community knowledge of substance use prevention practices. And so the way we're putting this process into action is kind of a three-phase process, and we're in the first phase of that process. And so that is listening to community voices and collecting stories. And then the second step is facilitating a community-led planning process. And the third is supporting the implementation of a community-created prevention plan. And so what we're going to dive into today is kind of that first step of the process.
And so today we want to introduce you to our project as well as share why and how we gather our storytelling data. Our project is located in Boulder County, Colorado, and it's focused on seeking the root causes of substance use within the LGBTQ plus and Latinx communities, specifically with youth members of our society. We are doing this work by continuously aggregating local survey data, as well as holding interviews and focus groups with Latinx and LGBTQ plus youth, their parents or guardians, and the adults who work with them.
So as I shared in the overarching process for this project, we aim to continuously use data to see trends in the Latinx and LGBTQ communities, specifically related to substance use, mental health, and related outcomes. However, if we are only able to look at the epidemiological data that we have available, this paints an incomplete picture of the root causes of youth substance use among these two priority populations. And when we're just looking at quantitative epidemiological data, what we see is there tends to be an erasure of these two communities. And so a few examples of how that is showing up in the data we have available is that first example is related to emergency department data. So our emergency department data is really only available for those who are over the age of 18. And then when we look at data for those who are over the age of 18, it's rarely broken apart by patient demographics. So we're not able to see outcomes related to sexual orientation, gender identity, race, or ethnicity. The second example is the behavioral risk factor surveillance system for Boulder County, which is a really robust data set in the number of adults they survey. But the questions they're asking specifically related to substance use are not as comprehensive as the Healthy Kids Colorado survey, which is our youth survey. at the school level. And so it makes creating a connection between adult substance use outcomes and youth substance use outcomes rather challenging. And then lastly, in Boulder County, we have two school districts. One participates in the Healthy Kids Colorado survey and one does not. And the one that does not, they have an internal survey that they present to the public. However, this external presentation to the public of their internal data is rarely disaggregated by sexual orientation, gender identity, race, or ethnicity. So while that provides a limitation, it has also created the opportunity, and that it allows us to identify a focused location for some of the youth qualitative data collection that Janice is going to describe in a bit. So related to substance use disparities, we know that LGBTQ youth face social stigma, discrimination, and other challenges that are not encountered by their cisgender and heterosexual peers. And this includes a great risk of harassment and violence and can lead to an increased risk for various behavioral health issues. And so using our Healthy Kids Colorado data at the local level, when we look at 2019 data, which is the most recent data we have available at this point, we see that locally LGBTQ+ youth are less likely to have an adult that they can go to if they have a problem or a trusted adult than their cisgender and heterosexual peers. And we can also see from other data, I don't have a chart on this, but just the importance of having that person, having that trusted adult, what that plays for substance use protective factors. And when we look at disparities within our Latinx young people, we know that there's a lack of culturally responsive and intersectional programming available both in the community-based setting and in schools. And from Healthy Kids Colorado data, we see that Latinx youth, or this survey specifically uses the term Hispanics, that's what we have on the graphs. Those young people are less likely to participate in extracurricular activities. And so we could infer that there's a connection between the two, the lack of culturally responsive programming and the lack of engagement in extracurricular activities. And gathering stories just helps us determine if this is in fact a potential point of intervention. Another kind of area we can look at using EPI data is substance use rates. And so looking at current marijuana use rates or past 30-day use in 2018, the graph on the left-hand side of the screen shows the use rates for Hispanic young people and white non-Hispanic young people, and that those use rates are virtually the same. That's what you see in that red box there. But then when we look at criminal justice data, what we see on the right-hand side of the screen is that there's a 47% decrease in the number of marijuana-related arrests for white youth since the legalization of recreational marijuana. However, for Hispanic youth, that decrease is much smaller, only about 26% in marijuana arrest rates. And we know that Hispanic youth are using marijuana at the same rates as white youth based on the graph on the left. And so this shows that white non-Hispanic youth are experiencing a greater benefit from marijuana legalization than Hispanic young people. And so again, gathering stories can help us point to possible areas of intervention, be it related to criminal justice reform, school policies, or community-based restorative practices. And then lastly, our available EPI data through the Healthy Kids Colorado survey shows us that for the percent of high school students who first drank alcohol before the age of 13, or we use this as a measure of early initiation of substance use, we see higher rates of early initiation among youth who identify as LGBTQ+ and Hispanic. However, a few years down the line, when we look at LGBTQ identified youth and Hispanic identified youth and their current alcohol use rates in high school, we see that they're actually using alcohol at lesser rates than their cisgender, white, and heterosexual peers. So therefore, qualitative data can help us kind of identify those community needs, maybe related to this example of early initiation, but also community sources of strength, looking at that lower use rates later on in high school.
And so the goal of this research was not only to get to those root causes, but because of the gaps we have identified in local and state quantitative data, but also to do it reflexively, noting the need to repair community relations and act as a partner for the well-being of the Latinx and LGBTQ plus youth. This involved meeting with gatekeepers or individuals and organizations that open up the possibility of connection for particular groups in society. Our purpose is to get qualitative data, and considering how the pandemic, as we've heard, has influenced the normally in-person interview and focus group process, we strove to make flexible research protocols that would be adaptive to either online data collection or in-person situations where we follow COVID-19 guidances. Last, we have and continue to recruit throughout Boulder County from areas considered remote like Lyons and Nederland and Ward, but also to grocery stores in urban Longmont. So our flyer started out looking like the one on the left. We were getting a lot of interest from adults who work with Latinx and LGBTQ plus youth, but not as much from youth themselves. For a few weeks, we reflected on how and why this could be and decided to make more conservative flyers for school teachers and counselors to have available in their offices. We figured since there is a rise in hate speech throughout the nation and sadly in some parts of Boulder County, that we should position ourselves as though we were the ally teacher who might not want to be themselves targeted for putting up a flyer. This allowed us to also recruit teachers, a population that is overworked and could greatly shed light on the situation with Latinx and LGBTQ plus youth in their classrooms. We are currently using the second flyer and will do so until the end of the data collection cycle. So once recruited, there are a few options we have set up to gather qualitative data. If the guidelines are in favor of in-person interactions, participants can physically meet for focus group or interview. There are some advantages to in-person meetings that are not available to participants and research alike. For one, there are natural intuitive breaks between focus group participants, and there's also this sense of not taking up the most space in the room because of how folks are socialized to share what is pertinent. In other words, holding back is easier. Plus, there are snacks in person. The virtual space is a little different since folks have been in front of their computer this whole time. They are experiencing screen fatigue and are a little bit less engaged in the virtual space. There's also no like immediate receipt of gift cards, which is how we compensate for attending an interview or a focus group. But likewise, oversharing is actually more common in the online space, even though we tell people like, you don't have to share everything you don't want. You know, you can set your own boundaries, but there's this sense of like the computer creates a sense of anonymity. So people share more. The true advantage, though, of the virtual focus group, however, come from allowing participants to use the chat function to direct message research staff with a question or a comment, which will then get spoken aloud to capture it as data without identifying the participant who shared it. So let me show y'all kind of how we do this. So what goes on during a virtual focus group? So this is an intro Jamboard. A Google Jamboard has allowed us to move what would normally be an in-person activity of motion, like a giant Post-it note with many people putting their ideas on a Post-it note to this kind of section. In many ways, this Jamboard works better for privacy concerns than an in-person model because participants do not know who is posting what. It normally says like anonymous raccoon or something. And so like, you don't know who that is unless anonymous raccoon decides to share, in which case we tell them, don't do that. They get to see outcomes, and we actually as research staff get to kind of feed off of what they write to then create more discussion. And these questions can be based on drawings, Post-its, or pictures that they place on the board. I get it. We're getting there though. So like during the focus group, we realized that even as participants themselves mentioned very relevant topics by answering the question, quote, what do you think of when you hear the terms substance use, end quote, that when it came to actually expounding on the topic, they were at a loss for words. But luckily for them and for us, the difficult and often taboo topic of substance use was and could be breached by the chat function. Though there was physical silence on the Zoom at times, as facilitators in the focus group, we did not feel the need to fill that silence, as there was a great deal of text that participants were inserting in the chat and through direct messages. Whomever received the direct message would speak the comment aloud so our recorders could catch it, but maintain the anonymity of the participant in question. And so not all silence was discomfort. Sometimes by having a participant's comment read aloud to the room, it actually created some more discussion to come from that comment. And this led to the relaxing of some taboos for the participants where they felt comfortable sharing experiences as well as creating a safe space to swear. And so this is our outro jam. So we do an intro jam board. We do the focus group itself, which is what you would imagine a regular Zoom meeting looks like. And then at the end, we also do a outro jam. So in this one, by the time we got to the outro jam board, the mood in the virtual space was much lighter, and the participants were also much more comfortable adding their thoughts and feelings to the question, quote, what mental health resources would be useful for you and your friends, end quote. We read out a few and even more discussion followed with an overall sentiment that being that school counselors dealing with behavioral health, or I think in Colorado we call them interventionists, should prioritize building trust with students and be present like for these youth challenges. You know, it's Thursday. That's what I say to myself. Even so, some concluding thoughts, some future directions. Even as we perform research, there is a need to modify and make it better, even as we do this. We move forward adjusting for the next cycle of research, noting that what worked in the online environment and what shifts need to take place to achieve meaningful interactions with the community. Our future plans are to hire youth to make mini research to make mini research projects using problems to address the gaps that we find in this research cycle. Then create a community action committee who would work with our data and guide the progress of the youth research assistance. In this way, our research can become more specialized over time, and our implementation can be guided by members of the youth, LGBTQ+ and Latinx communities. So thank you all for attending our talk gracias from a la raíz to the root.
Wow, thank you both so much. I've learned so much today. And this, I mean, from both presentations, but even more so in, you know, you guys really dove into, or you both really dove into actually connecting with youth and the communities, and particularly doing that virtually and dealing with the COVID aspects. I can imagine that probably most people on this call and in public health in general are grappling with those issues. You know, Anne and Olivia, they were just talking about how they're hoping to get to that point. And so I just think there were a lot of really great ideas and resources, particularly for youth. So thank you. I saw that looks like Audrey just put your contact information in the chat. We have one question right now, but again, if people want to come off mute or put them in the chat, I will go ahead and read them off as they come in, but please feel free to, we'll open up for questions now. So there's one about asking about the informed consent process you used working with youth, and what does data governance look like in Boulder?
So I can answer the first one in terms of informed consent. So informed consent that we use, well, first off, because of the rapid nature of this project, we did not have time to get to an IRB process. But because I have a lot of experience only doing IRB process, all of the processes were essentially followed. So we at first have a data information sheet for parents and for youth. One of them being created in such a way that each question is broken down. So what is this project about? Where is this information going? Why are you being invited to be in this project? And also and this should hopefully be a thing that we all know, but a voluntary step out of the project. So even if we have a focus group and you're part of it and you got the gift card and everything is passed, you still have the autonomy to remove yourself from the project. So that's one thing. In terms of, so that's consent. In terms of informed consent, we actually are going to be reaching out to every participant once we have a kind of report to kind of give back the data, but more so we want to incorporate those participants who are interested to become part of our community action committee. So we say in the consent document that if you are being used in some kind of presentation, government report, whatever, we will let you know. And so I've let people know we're doing this presentation. I hopefully will grab this slide deck, but also maybe if we have a link to this to send to them to see kind of how that information was presented.
And then I might be able to answer the question of about data governance, but I am curious about a little bit more details on what, if you have any specific questions related to data governance.
Yeah, I can answer that. Well, first, thank you so much. That was such an amazing presentation. So over at Jefferson County, we're just working through some of our data governance questions, as I'm sure other counties are also doing. And as a qualitative researcher, I'm always just interested in how data governance works outside of the IRB. And thinking a little bit about who owns the data, where it's going to be stored, and then any rules or regulations you might be following or have set for yourself around if that data is going to be deleted. Also, you mentioned recording Zoom sessions. I wonder if you could talk a little bit more about that, or if you just recorded voices. I have lots of questions.
Yes, so Janice can get all into the details about recording Zoom sessions. As far as data governance, yes, outside of the IRB process, it is data collected by Boulder County, similar to how somebody might be collecting. As far as ownership, it's technically under the same bubble as if a case manager collects data about their client who's receiving other public health services, and that goes into our stores. It's kind of falls under that same level of security. So as far as protecting personal identifying information, everything is kept in a place where only the staff who need to access it can access it. All staff are held to anonymity agreements. So if you accidentally stumble upon the data while trying to find your own file, you can't. You're not allowed to share it with outside parties. And then deleting the data, it will be retained for 7 years, which is kind of our protocol for all health data. However, so that's the kind of Boulder County legal protection side of it. But from the perspective of the community owning the data, I would just point back to what Janice shared around taking the data back to the folks who were sharing their stories. And then Janice,
great. Thank you so much. I really appreciate it.
Yeah. What we're doing is actually just recording voices. We have in the consent document, the Zoom because we use Zoom for Government. So we have a Zoom for Government addendum and the data sharing policy that they have. but because we don't know the extent to which, quote, third parties might be taking that data, we are only recording with digital audio recorders. And so and we're taking only screen caps of like the Jamboards, which are not even held onto the Zoom, they're held in Google. So, and similarly, that gets deleted after 7 years or probably sooner, but we are going to have copies in the report of all of these different boards so that the community can see like kind of the physical aspect of data also.
Awesome. Thank you so much.
Thanks for all the great questions, Rachel. There are a number of thank yous in the chat. And then another question. In the future, do you think you would plan to continue using an online platform for these types of discussions? Or would you switch back to in-person? And any thoughts on using some of these principles you talked about in person as well?
So what I have noticed is that youth do not want to do online. And it could very well be because they've been online for a very long time and they kind of want to step out of that. What I have noticed is that adults love online, would prefer it online. So we're just doing whatever the community wants in that case. In terms of doing maybe something similar like the chat function online in person, I have been kind of noodling around with that and maybe doing like a write it down on a piece of paper kind of thing, or like, and put it in like a little box that goes around, and then like that facilitator will read the questions aloud. And because we don't know the youth personally, like their handwriting style, that might be useful to do something like that. The Jamboards get real difficult in person because you do see who puts up a post-it. Like that's one thing that, and that creates its own like form of analysis too. So like you kind of get two sides of a coin, online versus in person.
Yeah, it's really interesting thinking about the anonymity pieces and what virtual has given us and taken away. It's difficult to take the best of both and bring them together, but it sounds like you're thinking about how. Then there was one more question. Do you think your report will be publicly available or only internally available?
So, as Janice has shared, there's a lot of plans around making sure that people are represented the way they want to be in our report. So I think it might take a few iterations, but we do hope to have something that we can share out more broadly outside of our agency and outside the folks who input data, just because this is a group that has taken a lot of thought and energy and sensitivity to connect with, and we want to make sure that like that work that we're putting in can also be beneficial to folks outside of Boulder County too. So short answer, yes.
Awesome. Thank you. And Valerie just offered up that Poll Everywhere is a good tool for word cloud exercises and short responses for input anonymously if you can count on all participants having a mobile device. So that could be a good tool to use. Does anyone else have any questions? We can open it up in general now for all 4 of our presenters today. We have just a few moments left. And I want to thank you all so much for presenting today and sharing both of these really wonderful projects. I know I've learned a lot and have been frantically taking notes on all of these things. But I'll leave it open for just one more minute if people have questions to offer up or any last thoughts. I know this question was asked earlier, but slides and additional handouts from speakers are available on the conference website. So if you are interested in reviewing the materials, please feel free to look there. Everyone will also receive a conference evaluation form through their email after the conference is over. And so please fill that out, even if you only attend one session or half of a session. It really helps to give our planning committee more information for next year's conference. And there will be a fun raffle where anyone who completes the survey, I believe, has a chance to win a $50 gift card. So that's pretty neat, kind of the equivalent of, Janice offering snacks for the participants at meetings. That's, I think, what this is incentivizing as well. So again, thank you all. We are now heading into a 30-minute break for the conference, and we would encourage you all to go on the conference website and listen to the 30-minute walk and learn, or walk and talk session, I believe it's called. And that is entitled "The Impact of Data Collection on Access to Healthcare Resources Among Native American Communities." So this is a really good option to get up, go for a walk, stretch, and just maybe listen to it as you walk, and get a little extra time outside, hopefully, before the next official session. So the next live session will begin at 2:45 p.m. And it's another breakout. So I hope you all will come back. I hope you enjoyed this, and I hope you enjoy the rest of your conference experience. Thank you all again.
Thank you.
Thank you.